Hello again, everyone. Welcome to another Hope, Power, and Healthcare with Chris Hemphill
Melissa Riley.
and also
Emily Brown.
Emily Brown. We have Melissa said guest, but I don't know. Maybe Emily's a co-host today because we're just gonna jump along the entire journey. But y'all, like, quick background. Chris Hemphill. I do healthcare data science and AI for a company called Modular Feedback. Melissa
Spend a lot of time with innovative founders, helping their companies grow and make it through what I say right now is a little bit of a fraught landscape of challenges in getting reimbursement and funding and keeping innovation alive.
But y'all have heard from us before. You know our background and all that. Hopefully, go back. You can watch previous episodes. But Emily Brown, Emily is attacking some major issues today around food as medicine and around health-related social needs, things that we all care about. I've spoken with people about that are concerned with the administration's lack of focus on health equity and things like that. But a lot of these things are being rebranded and supported under different means. So Emily, CEO of Attane Health, which is a platform that delivers personalized nutrition recommendations, helps address food access, concerns, and challenges. Emily, welcome. We are so glad that you're joining us this week.
Thank you for having me. So excited to join the conversation.
Appreciate that. So a big focus here, and you probably heard me say it on any podcast I've been to, is around leading by example. And we were talking a little bit about Melissa Riley's focus. Like a lot of these organizations that she works with, they all have a mission-driven theme. Because Melissa, because you've just gone into this space on your own, you get to choose who to work with. So we're just holding, like Emily has a great story with regards to going into this food as medicine space from a personal background, and really I think it's time to get into that.
Yeah, I love founding stories, Chris. I mean, they're some of my favorite moments when you get to meet a founder. Emily, do you mind sharing with us and our fam a little bit of your founding story?
Definitely. I also really love founding stories because it's always good to understand, kind of the beginning of the journey. And so for me, it starts with lived experience. I have two daughters that have chronic conditions where food is part of the standard of care. And like many Americans, we went through some tough times. I mean, we were on WIC, SNAP, and I'm actually a former Medicaid recipient and very grateful for that support. I mean, it really helped our family during a difficult time, but it was still really challenging for us to find and afford the foods to keep my daughters healthy. And so I started a nonprofit to get special dietary foods into food banks and food pantries. And as I did that work, really became obsessed with getting the right food to the right people at the right time. And I also had an opportunity to really just become a very active patient advocate in my local community. And so sitting on a number of hospital-based boards in my community and really understanding the role of policy and advocacy and shaping healthcare access. And so I've testified to the USDA, the FDA, and then I currently sit on an advisory council at the NIH. So I felt I had this really unique blend of experiences. First, that experience centered in lived experience, which really, I think, is one of the things that really makes Attane's work really powerful because we understand the needs of all of the individuals that come through our platform in a very real way and all of the systems that they're navigating, but also that practical experience of really being a patient advocate and centering solutions and helping health systems improve their patient experience. That was really important to me. But then the work at that nonprofit actually started one of the first food prescription programs in the state of Kansas. And so although Attane is only 4 years old, I've been working in the food as medicine space for over a decade, and that experience of running a food prescription program in a community-based setting has really helped inform, the build of the technology and kind of what are the things that are needed for all of the stakeholders. And then it's that experience as a researcher, really deeply understanding a problem that really I felt was unique. And I had an opportunity actually while I was at the nonprofit to do a partnership with the payer. I won't name the plan, but there was another technology vendor in this program and it failed. And it was really because there was a disconnect from the technology, and it was really clear to me that we need people building the technology who deeply understand the problem and understand the perspectives of all of the stakeholders. And so that the technology solved a problem for, say, the provider, but it fell flat for the community-based organization and the patient. And so all of those learnings really helped as I set on this new journey to build Attane and really focused on delivering high quality food and nutrition care that is personalized, meets individuals where they are, but also has that rigor to really be sustainable in healthcare and support our healthcare partners in measuring what matters. And so that's kind of how I got here today.
Incredible.
Beautiful way, yeah, a beautiful way to word it. And it makes me think about technology. Like as a technologist, I see technology as potential energy, potential solutions and things like that, rather than being the end all be all. I love the example that you put out as being deeply ingrained and requiring of yourself being deeply ingrained and understanding of the problems that people face, and being able to get really specific. Like, it's not just the technology, it's how we're using it, right?
Right. I always tell people like at Attain, we have it's a tech plus touch experience, right? Like the technology enables the scale, it enables the ability to have the data that we need for measurement and for return on investment, but we still have to have touch. I mean, healthcare is, part of healthcare is care. And that is always going to need some level of touch.
Chris, I definitely want to talk to Emily more about Attain. I've got tons of questions, and I think our fam will have questions too. Just even around that moment to pivot and change and go from being that person with lived experience to activating and building that nonprofit, which ultimately became Attain. We hear a lot about that from our innovators. Like, how do you have that courage to change and shift? But before we get into that, should we catch up real quick on where we spent our time this week?
Sure thing. Sure thing. That sounds fun. So let's start with you. Like we do have our catching up segment, and it's awesome to have Emily along with us. So thank you for joining us on the ride. But Melissa, what you get up to this week?
Chris and Emily, I was actually out at the #1 health plan conference that probably most of the innovators and digital health companies don't know as much about, and that was AHIP. And that was a interesting, fun mix. I got to attend with two of the companies that I support. One operating in the ABA space, the other in the virtual specialty care space. Really, really exciting. Kind of just split my time between the two of them, but then also to get a chance to join some of the conversations with some of the health plans and hear a little bit around what they're worried about. Now that I'm not working at a health plan, it's still really nice to be with that community and kind of understand what's top of mind for them.
So we're summer 2025, and you get to be a fly in the wall in these conversations. Can you share some things? What do we hear out there? What should we be focusing on?
Yeah, I think across the board, the first thing that I heard is a resolute anti that big beautiful bill. Now we all know that I never get political. That is not my jam. It's more just about understanding what the perspectives start to bring. But I do think the health plans are pushing back on a lot of the things that are within the big beautiful bill, in that they don't believe that it's going to be helpful for A, lowering the total cost of care, B, they expect to see rising premiums if the big beautiful bill passes, which they don't want, they know the consumers don't want. I did hear a little bit around, I think someone referred to it as like a nip tuck in reforms, kind of like plastic surgery for reforms in Medicare, which to me was an interesting way of putting it. I'll keep kind of looking at that. For Emily, there is some excellent supporters of food as medicine. I see them looking at it as an alternative to potentially the widespread use of GLP-1 or the unchecked use of GLP-1s, and a lot of emphasis on initiatives and innovation that can lower total cost of care. Thoughts, comments, reactions?
Emily, I want to throw it at you, honestly.
Yeah, I think that's great feedback, and certainly something that we are finding in the market, that there's a lot of interest around really kind of harnessing the power of food and nutrition to come along as a companion for the rise of the GLP-1 drugs, but also just to provide members with access to not only the food they need, but the support and education to help build those healthy habits to drive outcomes. So we are definitely seeing that in the market as well.
So oh, go ahead, Melissa. Sorry.
No, go, Chris. You're good.
Okay, so like as a founder in this food as medicine space, I guess when Melissa was talking about, we got this response to the big beautiful bill, and there's this landscape that's being written out to navigate. Can you tell us your thoughts on like some of the most recent news and just how that's impacted the way that you show up for Attane?
Definitely. I'd say that we're navigating some interesting times. I'd say that the big beautiful bill and some of the other kind of orders that have come out this year really have either in some ways retracted the market, but in other ways created opportunity. So there really is this kind of mixed response. And that's the way that we're looking at it. We're leaning into the areas where there's opportunity, where there's been some retraction. We're looking at our strategies and thinking about how can we, where can we continue to do work, maybe change some of the language, but still the work itself continues. And so we are excited about the opportunities that we can lean into to really leverage kind of that interest in food as medicine. And if nothing at all, I mean, I have never seen food and nutrition like this engaging in the public discourse. And so people are talking about what is in their food. Like, that's a positive.
So that relationship between food and overall healthcare, and there is, like when I read some of the language of the different initiatives that come out, there is an element where like they might not call it health related social needs or social determinants of health, but there is that element of wanting people to be the first line of defense rather than it festering till it goes into
Right. And I think that kind of focus on prevention is also a positive thing. And so I think for us, we're just, again, leaning into those areas of opportunities, which I think most startups do. It's like, where can we get traction and support while also kind of managing kind of some of the areas where there might be some pullback and retraction.
Melissa, you were also highlighting some issues around technology and AI and things like that. What's the language there? What are they talking about from that tech perspective?
Yeah, I knew you were going to go there, Chris. You
Had to.
Just, I know, it's just like a drug for you. I think the this theme of personalization really started to resonate, right? So AI gives us an opportunity to assist humans differently. There is a very clear mandate that at this point in time, no one feels comfortable with AI replacing humans for care. It's a little bit more around how can we use AI to create stronger personalization, more opportunities, I would say, on the automation side. Is there work that we can automate to be able to reduce that human burden? The subtext on that one is, operations teams, that are heavily manual they want to look to potentially replace that with the use of AI. But in some ways, that's just evolution. But I think there is still that fear that we lose that humanness in care. And so you kind of hear a little bit of excitement for opportunity to leverage AI in new ways, but also kind of that caution and restraint that we don't want to lose that person-to-person connection.
Mm-hmm.
Do you, I don't think that there's not like a lot on the table that's being proposed that's at risk of severing that human to human connection, right? Like
No, it's not. It's not. Like, I'll give you a couple examples. Like, some of the things I was super excited to hear about is a little bit more of care integration. So in two different sessions, we were talking about how now we see behavioral specialists sitting deep inside primary care. Again, it's a little bit like wonderful. Like 4 or 5 years ago, we were talking about how this would be the ideal, and now we're seeing people actually do it, right? And so I feel like we're talking about AI in the same way we talked about collaborative care or value-based care. It's like people are very excited for the potential, that we don't necessarily have the outcomes on all the use cases because people are just starting to apply the AI in different ways. And so you still see that safety, Chris, of, we're cautiously treading into this space, and here's that big thing that we're worried about. The more near-term worry really feels to be, maybe what's happening on the Hill. And again, this idea that like, what will cuts potentially in Medicare look like? What is going to be the impact of the cuts we saw in the NIH and other places where grant-based funding was really driving that innovation? There's still that call for innovation, but I may be a little bit of skepticality on those of us that are trying to get novel things done, that it just doesn't seem that innovation is happening as easily as it maybe did two years ago.
Emily, with your, like, we were talking earlier about a policy perspective, but as someone on the technology perspective, talking to a food as medicine expert, what's your reaction to some of the news and capabilities, et cetera, that you've seen around AI? And I don't care if it's positive or negative. You just whatever comes out, let's go.
Yeah, I think as a early stage startup, we're definitely embracing the use of AI. Right now, I think for us, it's mostly operational, right? Like, I think that's kind of like the easiest place to kind of start deploying AI within your organization. And, as an early stage company, what that means is just operational efficiency. And so being able to, leverage the automations and be able to kind of do more with less is really appealing, particularly as an early stage company where you're always kind of like managing cash flow and investment and, continued support of the technology. For us, we do see it being a role in kind of the direct, integrated into kind of some of the direct client facing technology. We have not done that yet, primarily because, as we sell into health plans, they're also still trying to figure out how they want to deploy or use it. And so for us right now, that risk of putting it direct in is, could potentially delay like the ability for us to actually execute. And so for us, we are excited about it. We're, toying with some things, but we have not deployed it directly just because there is still this like very cautious approach that our health plan partners are taking. So it's a positive for us, and we've embraced a kind of AI first approach, but it's in healthcare you really have to be cautious, and we don't do our work in a silo. We work directly with the plans.
So for our innovator fam out there, the people that are thinking about how to use these technologies, it's a matter of experimenting, exploring, and learning what outcomes could be impacted, but also being having an understanding of what risks your client base is going to be willing to tolerate.
Exactly.
So I made
go
it to AHIP, but I didn't hear from you both on where you spent your time this week. Chris, you want to go first? Or
Okay.
yeah.
No, okay, we'll throw it at Emily. We'll throw it at Emily.
Yeah, I mean, we had a busy week at the startup, preparing for launches, but I did have an opportunity to attend a session around kind of the impact of private equity on health outcomes, and it was really fascinating discussion. And sometimes we see all the big headlines in the news, and they're very much like negative, right? This hospital is closed, particularly where I sit in the Midwest, where we have so many rural hospitals that have been impacted um, by private equity. But as we dug into the data, it was really interesting and compelling to see that while there may be a couple of metrics that can be cautiously tied to outcomes, so like the rise in transfers at hospitals that are private equity backed, or the kind of, yeah, mostly the rise in transfers. But it also really focused on kind of like, well, without private equity, some of these assets would have just gone away much sooner. And so it really was a wonderful conversation about kind of, is it the right capital, the different types of capital, the horizons, and just kind of this question around like healthcare, like again, how do we fund innovation? How do we continue to think forward on improving access, and what is the role of capital? So it was a really compelling conversation.
Love to hear it too, because the way private equity is, like we hear about it in the media, and it's always presented the same way as this beast coming out of nowhere, ruining
Right.
everything. But like there have been zero hot takes on this show. I don't think, Melissa, I don't think I've ever heard a hot take from you. So the idea that, hey, let's look at what look at the nature of the funding backer. That's what it sounds like. Like look
Right.
at the nature of where these funds are coming from and where they're being directed, and rather than demonize the whole industry, like identify where actual opportunities to improve care exist.
And
I
I think
agree.
for me, Chris, the part that's so interesting is I'm so pro innovation that in some ways, like, I don't know that I get caught up in if the capital is venture capital, if it's private equity, if it's payer based funding. Like, I think I am so pro innovation that I'm like, if we can find any way to access funding so that we can keep some of this innovation moving, it's just one of those, like, harkening back even to last episode. Um, I'm so tired of us just talking about all the things that we want to do in the future. And I keep
Mm-hmm.
saying, well, like the future is here. Like we are in the future, right? And the question that I had wanted to even ask you earlier, Emily, I just going to ask it now, is that moment of activation. Like when you finally say, I have had enough, I am doing something about this. Like, can you take us to that? Because I think so many of our hopeful moments for the people that we talk to, Chris and I, it's really like, well, like, how did you do that? And I haven't been able to really unpack activation other than, just one day something in me snapped and I said, okay, I'm going to do this now. What was that like for you?
Yeah, I mean, I can tell you there was two moments. I'll talk about that activation that led me to starting the nonprofit initially, and then what gave me the clarity to move to a kind of social enterprise model, and to build a venture backed company. You know, I remember like going to the food pantry, standing in the line and waiting, and getting in there, and really there was not very much my family could even eat. It was literally two potatoes and a jar of salsa. And I remember asking one of the volunteers that worked at this pantry, like if they ever got any like gluten-free items, or those types of things. That's what my daughter needed. And she was like, well, you got something, didn't you? And
Wow.
I just like kept it together, got to my car, and just broke down.
Mm.
And then I just realized, like, you know, there's got to be some good that's coming from this struggle. Like, we cannot be the only people. The foods we needed were not widely supported in the federal nutrition programs, and then they weren't in the charitable food system either. And it was just wild to me that, the insurance would pay for the hospitalization or the ER visit, but would not pay for the food that was literally part of the standard of care, what the physician was counseling us to do. But then when you go to the store, it costs 4 times that of the foods that contain gluten. Like it just didn't make sense to me. And so I just thought, like, there's got to be a way. I've got to do something. And that it was just it flipped when I realized there is nobody coming to save us. Like, and that we can't be alone, that there's other people likely suffering in silence who just don't have a voice. And so I was just determined to make something positive of a very, very difficult season of our life. And so that
Incredible.
for me was the catalyst of like, I'm going to do something. And then, by the time I started Attain, the nonprofit was like 8 years old, had been running a food as medicine program, prescription-based program. We had integrated the referral pathway into our, like the large health system, and built all this capacity, and we were doing such great work. But it was clear to me that technology was going to be really important to taking the work to scale. And we had done this great pilot where we had looked at 2 different ways of distribution. One, dedicated vouchers in retail stores, 2, online distribution, ordered directly. And it was overwhelmingly clear, like 80% of our online vouchers were redeemed versus only 10% of the local retailer. And so like we had the data, and then I shopped it for funding, and nobody would fund it because they were like, you need to focus on your core business of food pantry and not building this tech platform. And, I always have looked at foundations really as kind of like the VCs of philanthropy.
Mm-hmm.
And everybody says they want to fund innovation. But then when you look at what actually gets funded, they're actually very risk averse. And so I remember talking to some really smart people, and they were like, hey, this platform, this is not a nonprofit model. Like you need to position this for investment funding, because there are funders who are not quite as risk adverse that will see the opportunity here. And so that is, that was one of the reasons I was able to kind of activate and say, maybe I need to think about this work differently. Maybe I need to think about innovation differently, and how we do the work differently. And so
And
those
tactically.
those two experiences were really transformational, and I guess both of them came from a place of like desperation, and nobody is coming to save us. But how do I leverage the resources, the systems that I have around me to build? And so it just started. I always tell people, like, at the very beginning, I was a mom with limited resources, on government assistance, had to borrow the money to start the nonprofit. Like, and so I didn't have the financial capital, I didn't have the social capital. But when I left the nonprofit, they had a 7-figure budget. Like, we grew, and it's still doing great work today. And, now, 10 years later, it's like I'm a venture-backed CEO supporting moms on Medicaid, which is such a full circle moment. And so with all of the challenges within, there are social challenges, I still say, like, this story is not possible anywhere but in America.
It's
So it is,
incredible. It's
yeah.
so incredible, and I appreciate you so much, like sharing that those moments of activation with us. And then, Emily, like, as a researcher, even tactically, because I think so many people maybe have some of the frustration but don't actually take that first step. How did you even know how to take some of those first steps? Like, you talk about, I was able to like start a nonprofit. Did you just type into Chat GPT, which I know you didn't have at the
I
time?
didn't have
Like,
ChatGPT, but yeah. No,
how does
I
one start a nonprofit?
honestly, initially I was very naive, and I was like, I'm going to change policy. I was like, I'm going to change the WIC food package. And like all the stars aligned that when I decided to do this, like they were under a review. And so I started like having conversations with people, and they were like, oh, this is like one of the most complicated of the federal programs. And everybody kind of told me like, I don't know, like this is going to take 20 years. Like you need to have a different approach. And so I just kept thinking, well, if it's going to take 20 years, there's going to be a need for data. Like these policymakers need data. And that's when I was like, well, the only way to do that is to create a direct services program so that we could actually generate the data. Like we can help people today, and then we can generate the data that the policymakers need. So that was my like whole approach. And so the nonprofit from the very beginning, we spent a lot of time on our kind of intake and our data tools. Like data was always really important to me. And technology was always important to me because in the kind of food assistance world, you know, I always tell people these are communities that are doing such great work with so few resources. It's like they're running retail establishments without the technology, without you know,
Point of
like
sale
full
systems
point of
and
sale systems, inventory systems. And so I feel like, you know, I was and these systems are often staffed by retirees. I mean, like these are whole systems that are dependent upon volunteers to exist. And so, you know, I'm showing up, and at the time, you know, I was still in my 20s, and I was like one of the youngest people running around the food pantry, like saying, okay, wait, we're still tracking this in pen and paper. Like, why aren't we, you know? So I was a little impatient on like, can we do this in a more efficient way? So, yeah.
Can we pretend that there is a another Emily Brown out there today who is starting her business, like going down this route of trying to acquire funding and going down this building a tech platform route? What would you tell that new Emily Brown?
You know, first of all, I tell that new Emily Brown that they can do it, that it's possible. That's the first thing I would say, is that it is definitely possible. I would say that fundraising, like everything else, is a skill, and that you can learn it too. It's all about, you know, harnessing your story, having a plan, and, you know, building the relationships that are going to not only help you with funding, but really help move your business forward. And so I would encourage them to, you know, find resources to help them harness and build those skills. You know, practice makes perfect. I always tell people like everybody's bad at something until they're good at it, and then you're good at something until you're great at it. And so it just takes practice. And so building those relationships, having conversations with potential investors, and practicing those skills.
And how did you find your first set of investors? I love to talk to a lot of my founders today, and I know there's lists that sometimes they share, or you know, they look to advisors to make these warm intros, and there's kind of like a little dance around it. But I'm imagining you're kind of in Kansas and you have a
Yeah.
nonprofit. It's very different than the venture world. How did you cross that chasm to find
Yeah.
them?
Well, it's actually interesting. I always tell people that um, it's two different worlds, but actually they're linked. I mean, people forget that family offices often have like a charitable or philanthropy arm, and then they have an investment arm. And, you know, my first investments in Attain really came from the relationships that I built when I was running the nonprofit.
Wow.
It was those connections that I had made and the relationships that I had fostered there, that were able to bring in those first investments, the pre-seed dollars. I mean, I am, you know, definitely a founder from an underrepresented background. You know, I'm a woman, I'm a person of color, I live in the Midwest. Like all of the things, you know, say that like data say that I shouldn't be successful in this area. But I've been able to be successful really just because of the network and the relationships. And that to me, you know, is what propels businesses forward. You know, you've got to have a great idea, you've got to be able to, you know, execute, but even executing is dependent upon your ability to build relationships with the right people. And so I would just encourage anyone that is thinking about going down this path to really focus on building relationships and building them with the right people, and also acknowledging that those investments and those early supporters may come from uncommon sources. You know, you may not have the Y Combinator experience, but that doesn't mean that you don't have a path forward. And so, my story, again, I think there are lots of other Emily Browns out there. There can be, there should be, which is why I love the opportunity to talk about this on platforms like yours, so that it's visible and people can see that it is possible.
We
It's
love it. And
needed.
Chris and I want to make more Emily Browns, right? Or help support Emily Browns
Yeah.
as they have those moments of frustration that lead to these moments of activation. I just think that's so, I'd love to find more data on those moments.
It's 100% needed. And one data point would be the one that you brought up earlier, where there was that more tech oriented company versus like what you brought in with your experience, and just the fact that the one that had the deeply embedded knowledge about the community that was served, that's the one that survived and thrived. And that's just the example that, hey, your voice is needed. Yes, the road might be a little bit rockier to find that funding, support, and network, but we love having you as an example of what happens on the other side.
And pivots, right? And I think, Chris, that we didn't hear about your week, so I'll pivot back to that just for a moment. I'm like so into Emily's story. We're not making it through catching up, but it's okay.
Sure thing. Yeah, we're 2/3 caught up, and mine isn't as in depth, but it's kind of interesting. Brand started with a brand new client this week that we've been working on pretty hard, and they are a health plan, Scan Health. Do I edit that out or not? Like I'll review the policy, but it's Scan Health, and the thing that really struck me is being on the internal as a data science advisor, as they're making sure that their data flows are overall serving the need on the other end for members and others that are looking to access data about their physicians and the care they'll receive. It was really striking how in this health plan side they have that mission focus. I didn't necessarily know all the details about who I was walking into and who I would be partnering to serve, but it was a big reminder that even though a lot of the work that we're doing involves tables upon access databases, connecting into all kinds of other databases and structures and things like that, you still can't divorce yourself from understanding that the work that we do on the inside, optimizing queries and databases and things like that, has a real impact on the way people can access the care that serves them.
And so I was basically raised 20 years, 3 different payers with this like health plan persona. And then over this last year, as I've started my company to help other founders, then now I take on a little bit of a founder identity, or at least a supporter of founder identity, and start to shed off this health plan identity. But Chris is doing the opposite. So he was deep startup, deep academia, and now to enter the world of health plan, this just makes me so excited. Like Chris is becoming a health plan person.
You sent me a text saying, hey, you're becoming a health plan person. I was like, I have not fully processed that yet, and I still haven't fully processed it. I will let y'all know in a couple of weeks, but I'm like, what does that mean?
You may be dissociating from your identity, Chris, but I am not dissociating from it for you. And I'm going to take some observations of how does Chris shift as he gets deeper and deeper into the health plan.
Well, talk to me. What to expect?
Yeah, so what to expect? I mean, I actually think there's so much goodness inside a health plan. I know that opinion may not be shared by everyone, but when you boil it down to its core, it's really almost, in some ways, it's some examples, Emily, of what you were sharing about the food pantry, right? You have a set amount of food for a population, and there's some levels of using clinical policy, governmental policy to be able to say which food is allocated to what person. And what I love about being there is that you're always trying to do the maximum amount of good to the most amount of people, even if some could argue, you know, you're trying to do the minimum amount of good to the maximum amount of people. But really, like Chris, like your experience is so true. You don't wake up in the morning going, I am a health plan person, let me deny care. It's really around, I have a limited amount of resources. Sometimes people aren't even calling me, so I'm not even aware that they're in need of the care and I can't actually help them. And then when they do, it's how do I choose between all these different options to be able to help people get the care that they need when there's such asymmetry in the information.
And overall, I think it's easy to like I was talking about, like with people taking shots at private equity, also people
Right.
taking shots at health plans, because we can point to some very negative stories and negative outcomes that impact people's care. But we advocate for this a lot, but when we start breaking down the barriers in communications, goals, strategy, and data among these different players in the market, and I'll say this, it seems like from early conversations that's the goal of this organization, then there's just the opportunity to do and create. And the tough thing about health plans is the concept of, if there's some limited number of resources, we're trying to figure out how to allocate appropriately. So I see that, like, I'm going to go into a little bit of a personal story with my partner Shay, and like she's a OB-GYN at Henry Ford Health System, and somebody has to make the schedule, and everybody has these different needs with their scheduling and everything like that. And the person doing the scheduling, they're right there with them. They're a resident or a doctor too, but they're having to make those trade-offs and things like that. So it's a difficult conversation. Difficult needs, but overall the idea, I'm highly supportive of how do we allocate resources in the right way.
Absolutely. And as we think about this idea of, allocation and time, and trying to link it back to our thesis of hope, right? I think we're always looking for these good things. And so one of the things I remember that was really, really moving to me in my last role at a health plan is, on my comms person, we were often looking for great stories because we wanted to almost in some ways try to tread back the narrative of, care denial, but look for moments where we were really able to help people. But wouldn't you be surprised, there's so many rules around what information we're actually allowed to share. And then you always want to keep people's privacy paramount. And so we just didn't have as many opportunities to tell these good news stories to maybe counteract a lot of the bad news stories. And so maybe linking it back to you, Emily, as our guest co-host, can you tell us 2 or 3 good news stories about Attane and things you're really proud of Attane doing over this last year?
Yeah, so one of the things that we're really proud of, we recently had kind of some casework published and by the Center for Healthcare Strategies, and it all about our work in Kentucky with patients with diabetes. And so really excellent outcomes. We impacted all of the diabetes measures, lowering A1C, and also improved engagement with primary care. So it was successful work, and I'm really proud because to do work here in the heartland, where we know there's just significant burden of chronic disease, and often when we see kind of the innovation, we see it taking place on the coast. And so I'm really proud of doing this work right here in the heart of the country, where we know there's just significant need, and the challenges of individuals living in both rural and under-resourced communities. So very proud of that work. We're also doing some really great work in Kansas with high-risk moms. I'm very proud. One of the case managers that we work with at the health plan just says, just by simply having the Attane program available, how it's allowed them to engage more with their with their members and get them enrolled in the other kind of resources that the health plan needs. So it's not just even the direct outcomes of participants and members in our program, but it's just by just even having the program, they're able to engage. So I'm just really proud of that work that we're doing to support vulnerable populations and really empower them through personalized food and nutrition care.
That's incredible.
And I'm curious about the scale at which y'all are operating, because what's the overall number of lives, or how do y'all measure yourselves in terms of the scale of the operation?
Yeah, we're still pretty early on. We've got some upcoming launches that we can't talk about yet.
Mm-hmm.
Really excited about those. That's going to really take our work to scale here. But just really in the last year, on our platform, we've served just under 1,000 patients. But what's really exciting is we're serving the patients that have been traditionally very hard to serve. So we do a lot of work in communities where there's significant rural population, where there's been disinvestment. And again, we've done it in areas where we've really been focused on how do we continue to drive the innovation and build the case for reimbursement. So we're not just only working in places where there's reimbursement that already exists. We've been working on how do we go and build partnerships with health plans in an effort to build that evidence for reimbursement. So I'm proud of that work.
And that's laying down an important pathway, because I think that path to reimbursement, if it with y'all staying in there and fighting that fight, it opens the door for others, because the reimbursement picture it's started off non-existent, and there's interest in it, and it's growing. That's
Yep.
what it seems like to me.
Yes, definitely some traction there.
I had another. There was a thought that came up a little bit earlier, which we were talking about, kind of that innovation timeline with AI and other technologies. And I was having an offline conversation with a friend of mine who's a machine learning engineer, and I said, "Hey, what happens?" And I said, "I'm just spitballing here, but you'll have something at like a very AI focused conference like NeurIPS, where they're talking about like the latest cutting edge, like some researcher came up with an algorithm that does X or Y, and then you got a 2 or 3 year window where healthcare innovators and startups start focusing on it, then a 4 to 15 year window to where there's like early adopters in those bigger players, and then that broader focus." And I just wanted to zoom back with you, because like you're dealing with, hey, we're developing some technology, but we know that on the other end, these plans and parties we work with, they might be too risk averse to go forward with the technology like this right now. But if that didn't exist, if the risk aversion didn't exist, what are some of the things that you'd be looking forward to that technology can enable?
I mean, I think Melissa said it earlier. I mean, it's really just about the personalization, right? Like our platform offers personalization today, but with AI tools, it just kind of puts it on hyperload, and it allows us to be so much more efficient with that personalization. And that's what gets me really excited, because as we know, healthcare is so individual. It's very personalized, and that's when we get the best outcomes, is when it is personal and meets us exactly where we are. So that's kind of how we would deploy it, but we have been cautious, obviously just at where we are and on that adoption of innovation.
Speaking of innovation, I just had to add this in because I got this new refrigerator, right? And this refrigerator, it allows you, I mean, this is horrible, right? It allows you to actually see what's in your fridge, right? Like it has a camera into the fridge, which is wild.
Oh,
My
wow.
husband likes cooking. I do not, right? And so we end up with this like innovative fridge. Then what I heard the other day is that you can take a picture of what's in your fridge and give it to ChatGPT, and it can tell you what to make with your items, right? So Emily, tell us a little bit about like how Attane feels to a member. Like, will your AI get to a point where you can have this personalized coaching, and then it can look to items like in the grocery store that are customized to you, and then tell them how to make it? Like, is that on your product roadmap? Or, Melissa, you're way off on where you're headed in this innovation land.
No, you're not way off. You're not way off. Definitely we see it as an opportunity to really kind of, support people with making this decision, that old adage question of like, what do we have for dinner tonight? And really simplifying that, making it practical and easy, but then personal. So yeah, you are not off at all.
I love
Why?
innovation, right? I'm
Seriously.
like, I gotta find Chris. I'm like, can we go get Zapier, right? Or Tascade? It can take my picture, upload it to Chat GPT, and then send an email to my husband so he can be like, make this for dinner for Melissa.
Yes, I love that.
I can't wait to see it happen. It not only addresses a need in a healthy way, it solves for a huge amount of arguing and bickering that might go on around 6 p.m.
Yeah, in the partner,
Yeah,
like who's making dinner? Is there food, right?
right, right.
Well, Emily, you've gone on this whole journey with us. Done the catch up. We've been talking about the company and everything like that. Let's bring you into the pop culture segment of our conversation too. And I'm going to put you on the spot too. Like, we like to talk about like what's been hitting the soul. Like, is it TV? Is it movies? Is it book or some song that just came out? What's been on your repeat for the past 2 weeks, or what's been some pop culture you've been loving?
Some pop culture. I mean, I'm looking like, let me look at my Spotify. What have I been listening to?
Oh, Chris asked me. I'm so ready for this question while Emily gets ready
Hit
for
us,
her question.
Melissa. Hit us, Melissa.
Okay, so Melissa has gone deep into nostalgia land, and
Mhm.
I binge watched because I had this red eye flight and my Wi Fi went down a little bit. So I got to watch a couple episodes of And Just Like That, which is the evolution of Darren Star's Sex in the City, right? So it's like Carrie, Miranda, Charlotte, not Samantha. Samantha has not come along for this journey. Um,
Right.
and they are now probably in, let's just say, the later stages of parenting. Or for Carrie, who didn't have children, she now meets Aiden, who of course Aiden is back, and Aiden's family. And so Charlotte is able to get Adderall because there's an Adderall shortage, which she then gives to Carrie, and then Carrie brings to Aiden's son. I'm sorry, I'm spoiling episode 4 for
Go
like
first.
for many of you out there. But in the mental health space, this resonated with me on so many levels. First of all, the fact that you cannot get your ADHD medication over state lines, right? Even,
Yeah.
even if, let's say, you have divorced parents who have, children may have to travel between different states, right? The medication can't be prescribed over the state lines. And then the second is to really look at the impact on families where children have mental health needs. And I thought it was an incredibly realistic portrayal of family dynamics and ADHD and children with mental health. Um, for our friend Carrie, who, spent more time worrying about men and shoes, this was really her first foray into that family dynamics. And so I just thought they did a really good job of explaining some of those family challenges.
Yeah, that's great. I mean, and that really resonates with me. That's why I'm like, what have I been doing? And it's because I've actually been living that very narrative.
Mm.
This week, I'm going to get very personal. Our family has been impacted by mental health. My daughter was admitted to residential treatment on Thursday. So,
Oh,
it's like I've been navigating this entire healthcare system from the pediatric behavioral health landscape. And as someone who works in healthcare, someone who, you know, is a skilled navigator, this has been really tough, like
mm,
almost unimaginably tough.
I'm
Um,
so sorry.
so,
And
it's just, so I have not had space to really kind of engage in pop culture, but I do have a gospel song that's been on repeat because that is what has been getting me through the day, every
oh,
day.
share us. We
Yeah,
will link it out because we also
most
talk
definitely.
about songs, movies.
Yes,
Yes.
I will send it. It's a it's like it's a song by Lecrae and Scotty Whoop, so it's like gospel hip hop, but it has just been getting me through, and he talks about his own personal journey with depression, and so it's resonated with me this week. So that's what's been on repeat for me.
What was the name of the
Well,
song again?
It's let me pull it up here.
and you are definitely not alone in that journey,
No,
right?
it's
There's so
it's
many.
it's no weapon. It's like a remake of the Fred Hammond No Weapon Formed Against Us, but it's like they brought it into the to the to the 21st century, and it's just the words when I listen to it, it's just like it gives me the energy to just keep moving forward, knowing that no weapon formed against me shall prosper.
That's beautiful. And
Yeah,
like, thank you also for sharing your story about that family dynamic.
yeah,
It's and Melissa, like I love the example you brought up because like it's something that it's not as represented and brought out as it should be. So really appreciate
And
hearing from
so
that
many
perspective.
struggle, right? And so
Yeah.
so many struggle, to find the meds, to
right.
stabilize children right now, to just manage with, we all were joking. I had to edit it out earlier, but the it's summertime and the kids are now outside of their routines of school, and
Mhm.
just yeah, there's a lot that hits them, and I feel for our children right now.
Yeah.
Well, I guess my pop culture contribution it doesn't have the same depth, but I have been watching. I'm gonna confess, I've been watching those "Pop the Balloon" or "Find Love" videos
Oh,
with Arlette. Arlette, you know those,
yeah, I'm familiar with those. Yes.
Melissa? Okay,
No.
pop the balloon. Here's
Okay.
why I like so pop the balloon. It's this dating show where you have the guest. They come on, and Arlette, she's the host. She brings them on, and there's a lineup of people. They've all got balloons in hand, and she says, if you like what you're hearing and seeing, don't pop that balloon. But if something's just a little bit off, or you get the ick or whatever, pop the balloon. So when you're watching, like there's the like somebody walk out and the balloons start popping and they start talking to each other, and there's like other variations of it that are more like ratchet, but I like the way that Arlette, she brings class and dignity to it, honestly. And it is like she it's a black dating show, and what I like about how she helps with it, like the way her guests are portrayed, like it's a very like sophisticated conversation. Like most other dating shows are like trying to get those viral moments and things like that, whereas this one, it just feels like real people and people that you'd be proud of. Like there every time one of the guests is a data scientist, I'm like, all right, my people around here.
And does she approve of you watching the show around popping the balloon? Is she watching this with you, Chris?
She doesn't watch it with me. I think she's seen a little bit of it, but her, like, we watch Love is was
Love
it
is
not Love is
Blind.
Blind, Love on the Spectrum. We watched that
Oh,
together.
I love.
Okay.
Yes,
Um,
love.
Love that show. But I got my friend into it. He's from Alabama, country boy and everything like that. But I'm like, you need to watch this show, and I'm just
I'm gonna
I'm
watch it.
getting
I'll
everybody.
let
Yeah,
you
pop
know.
the balloon. Yeah, it's just like it's not complicated or anything like that. It's just something good to have on and watch a few minutes and see how it goes. It's just fun.
Amazing, amazing. Well, I know what I'll be watching this weekend.
And same for me, same for me. And I know what I'll be listening to as well.
Yes.
Yeah.
Yeah.
Well, this was incredible. Um, Emily, I think maybe we'll let you give us maybe a parting thought. Like, so we always try to center our episodes on hope, and boy, have you just brought so much hope to me just for what you're doing and the good that you're bringing to the world. I'm just so excited. Are there other things that you're really excited about, Emily, over the next couple of months, and that you want to, any message you want to leave with our fam?
Yeah, I mean, I'm excited, as we continue to grow at Attain, and there'll be some announcements coming in the next few months about new partnerships, and how individuals can access the Attain platform. So I'm excited about that. And I'm just also excited to just, again, be in this conversation with innovators, talking about the innovation in healthcare and the hope that it brings. Because I do believe that, like you said, Melissa, so many people that are in this space come to it mission focused. And so I'm just excited about what we can do to improve health together in the future. So
Beautiful. And Emily, the way you framed up your story, where you're from, and the type of operation, I hope that people listening to it who don't come from that traditional Stanford MIT background or whatever, like, I just want them to say we can do it too.
yes, for sure. It's possible. It is possible.
Well, with that, thank you very much for joining us, Melissa. Fabulous Q&A today. I wanted to call that out, and to the fam, we'll see you next week.